All right, hello, welcome everyone. My name is Yousef Munayyer. I'm a non-resident senior fellow here at the Arab Center in Washington, D.C. And on behalf of the Arab Center, Washington, D.C., I want to thank you for joining this webinar on COVID-19 under apartheid. Before we get started with our discussion today, I just would like to remind everybody who is watching online that they can submit their questions through the Zoom Q&A feature, and we'll be fielding questions from there after our initial presentations. You can also send your questions via email to events@arabcenter.org. So I hope all of you are joining us and doing well during these difficult and uncertain times. As everyone around the world is dealing with an unprecedented pandemic that has altered the way that we live our lives. Here in the United States, one of the things that we have seen come to the fore during this crisis is the ways in which the response to the pandemic has highlighted inequalities that exist within our society. We have seen a disproportionate number of victims coming from the African American community here in the United States and among people of color. We've seen the ways in which essential workers tend to be those with the lowest pay, the least job security, and the least physical security for their health as well. We've seen the way that our economic system has severely impacted those most disadvantaged. And of course, we've seen the way that our health system has struggled here in the United States to cope with the virus, and the response to it has really highlighted all of these strains and inequalities in our society. So what then, if this is what we are seeing in the United States, the richest, most powerful country in the world, what then does the response to COVID-19 look like in a place where inequality is far more pronounced on a regular basis when there is no pandemic? But there are other plights that are affecting society. We'll be discussing the threat of the coronavirus pandemic in the West Bank, East Jerusalem, and in the Gaza Strip, as well as for Palestinian citizens of Israel. As Israel's policies of occupation and settler colonialism continue in the midst of this global health crisis, we'll ask what additional challenges are Palestinians facing under military occupation, apartheid, siege, and various discriminatory policies. We're very fortunate to have with us two fantastic panelists today to help take us through this discussion, and I will be introducing them now in the order in which they will present. We're very happy to have Yara Hawari with us. Yara is the Senior Palestine Policy Fellow of Al-Shabaka, the Palestinian Policy Network. She completed her PhD in Middle East politics at the University of Exeter, where she taught various undergraduate courses and continues to be an honorary research fellow. In addition to her academic work, which focused on indigenous studies and oral history, she's also a frequent political commentator, writing for various media outlets, including The Guardian, Foreign Policy, and Al Jazeera English. We're also very happy to have with us Deanna Buttu. Deanna is a human rights lawyer and an analyst based in Palestine. She's a frequent commentator on Palestine and Israel's violations of Palestinian rights. Her writings have appeared in the New York Times, the Washington Post, the Boston Globe, CNN, and the BBC, among others. She holds degrees from the University of Toronto, Queen's University, and Kellogg School of Business, as well as Stanford University. So with this, I am going to ask Yara to begin with her opening comments, and we will go from there. Yara, the floor is yours.
Thank you, Yousef, for hosting this, and thank you to all of you for participating in this webinar. So I'm just going to cover really briefly a sort of give an overview of COVID-19 in the West Bank as it happened, the restrictions, how Palestinians in the West Bank and Gaza, for that matter, have been dealing with it. And so some of you might already know a few of these details, so I'll try and not dwell too long on them. But the first measures that were taken against COVID-19 in the West Bank occurred early in March, quite ahead of a lot of other countries around the world. There was a confirmation of 7 cases in Bethlehem that were linked to a Greek tourist group. The Palestinian Authority subsequently declared a state of emergency, and it imposed a lockdown on the city, on Bethlehem, banning all entry and exit points, as well as enforcing a curfew on the residents. The PA then announced restrictions across the West Bank, including prohibiting travel between governorates, shutting down public spaces, including education facilities, schools, etc. And then on March 22nd, following a steady increase in cases, a curfew was announced, meaning that people could only go to supermarkets and pharmacies within an allocated time period. At the same time, as the PA was imposing these restrictions, there was also civilian checkpoints that were set up along rural roads, particularly in areas where the Palestinian Authority is not allowed to operate under the Oslo restrictions. And so what these checkpoints did was they were manned by local people, and they stopped drivers. They did rudimentary, and they continued to do rudimentary and basic health checks, and non-residents would be turned away. They were also particularly on guard for returning workers from 48 from inside the Green Line, and people trying to avoid quarantine, which I will talk about shortly in a bit more detail. So meanwhile, in Gaza, people began taking precautions in the cities around this time as well. They were buying hand sanitizer, disinfectants, and masks, which meant that there was actually quite a severe shortage on these products very quickly. And you may have noticed at this time as well in the media, there was this narrative that Gaza was protected from the virus because it was under siege. And so sort of putting a spin on the Israeli blockade, that was some kind of saving grace. What this narrative, of course, left out is that the blockade has devastated the health system in Gaza, and that thousands of people will die every year as a result of the siege, either through Israeli military attacks, or because of poverty, food insecurity, or because they can't get medical treatment, and the Israeli regime won't give them permits to be treated elsewhere. Now, the Hamas authorities were very vigilant in the week running up to the first declared cases. From the 13th of March, anyone entering in via Rafah or Eretz was placed under a 2-week quarantine, and Hamas actually turned many of the schools into quarantine facilities. I think about 24 schools in total. On the 21st of March, the first 2 cases in Gaza were announced, and these were 2 men returning from Pakistan. According to the Hamas officials, they were placed in immediate quarantine, and all the people that they came into contact with were also supposedly placed into quarantine. Following that, the Hamas authorities announced a halt to all weddings, public gatherings, and mosque services, etc. Now, I think it's important to note that what makes the West Bank and Gaza different from other places during the pandemic is that they're confronting COVID-19 from a reality of military occupation, which weakens the ability of not only the authorities, but also the Palestinians themselves, the Palestinian people themselves, to respond effectively to this deadly virus. We've seen that many healthcare systems around the world really struggling to deal with the pandemic, in Europe in particular, and now the US. But what has to be remembered in Palestine in particular is that this occupation, the Israeli occupation, has seriously depleted the medical capabilities in the West Bank and Gaza, and it's a deliberate depletion. The health system is incredibly donor dependent, and there are shortages in equipment, medication, staff. All of this is due to Israeli restrictions on imports, Israeli military raids. In Gaza in particular, which, may I remind you all, was actually deemed unlivable by a UN report by 2020. So this is the year that Gaza is supposedly unlivable, although by most people's standards, it was unlivable many, many years ago. But in Gaza, the health system has been so devastated and is already struggling to deal with the medical cases it had before the pandemic. At current count, Gaza only has 78 ICU beds and 63 ventilators for a population of 2 million. Now, whilst this pandemic is ongoing, so are the daily manifestations of occupation, such as continued demolition of Palestinian homes, military raids on Palestinian villages and towns. But there have also been more direct and insidious attacks on Palestinians by the Israeli regime who have been trying to confront the virus, such as, for example, the destruction of a COVID-19 clinic in the Jordan Valley, the arrest of Palestinian volunteers attempting to distribute supplies to impoverished communities in East Jerusalem, the shutting down of another COVID-19 clinic in Silwan, a neighborhood in East Jerusalem, because they were using COVID-19 tests provided by the Palestinian Authority. And the Israeli regime forbids any PA activity to take place in East Jerusalem. So that was the excuse they gave to shut down that clinic. And importantly as well, something that we shouldn't forget is that the Israeli occupation authorities are also failing to take any preventative measures to protect Palestinian political prisoners who are being illegally incarcerated within a military prison system that fails to meet even the most basic of health and sanitation standards. Now, recently there was a particular worry because there was a recently released prisoner who tested positive for the virus. But since that news, we haven't heard much. For what we know, there's actually been very little testing in that prison. And overall, the Israelis haven't taken any steps to release Palestinian prisoners or detainees or to adequately mitigate and prevent an outbreak in the prison. As of this month, April 2020, there are about 5,000 Palestinian political prisoners. And this number includes 432 administrative detainees, 41 female detainees, and 183 child detainees. And COVID-19 presents a particularly acute and immediate danger to these Palestinian prisoners and detainees because they already endure incredibly difficult and dire conditions within the prisons themselves, including systematic torture and ill treatment, pervasive medical negligence, overcrowding, a lack of proper ventilation, access to sanitary products, etc. So all of these conditions make Israeli prisons really, really dangerous breeding grounds for COVID-19. And they really compound the vulnerability of Palestinian prisoners and detainees. And it's important to note that actually hundreds of them are already suffering from chronic diseases that go untreated. Now, amidst all of this, there has been some attempts to put a positive spin on the pandemic in Palestine and Israel. I'm sure all of you have heard that one of the most insidious attempts at this was to put forward a narrative of coordination or cooperation between Israel and the Palestinian Authority, fighting the pandemic as a common enemy, bringing two sides together. And we've actually seen international bodies commending this cooperation. The UN Special Coordinator for the Middle East Peace Process, and that is a position that still exists, which shocks me, Nikolai Mladenov, he called such coordination excellent in a speech not so long ago. Now, the coordination, we have to be very clear what they're referring to here. The coordination that they're referring to is happening between the Israeli government, or specifically COGAT, the Israeli Coordination of Government Activities in the Territories, as it's officially called, and the Palestinian Authority, as well as with international human rights organizations, the UN, the WHO, for medical supplies. So for example, Israel coordinated the transfer of 3,000 COVID-19 test kits and 50,000 masks that were donated by the WHO to the PA in the West Bank. Now, in the West Bank, there are estimates that that over 40,000 test kits are required, not the measly 3,000 that Israel allowed the WHO to deliver. There was also transfer to the Gaza Strip of, I think, about 500 WHO testing kits and something like 1,000 protective suits. So, what we're seeing here is, in effect, the Israeli regime, which is maintaining a violent military occupation and has completely depleted the capabilities of the Palestinian healthcare system, is being praised for allowing tidbits of medical supplies from international actors, despite its own responsibility under international law as an occupying power to provide the supplies itself. So I think it's really important that we shift from this narrative of cooperation and that we highlight the Israeli occupation itself as an instrument of comorbidity. In other words, not only does the occupation exacerbate the conditions for Palestinians to be susceptible to infection, it's also directly responsible for those conditions. And so I think it's incredibly disingenuous to argue that now is the time for cooperation and dialogue between Israel and the Palestinian authorities so that they can confront the pandemic. What we should be arguing instead is now more than ever, or now as it always has been, is the time to end Israeli military occupation and settler colonial expansionism into Palestinian land. Another important point to mention, or an issue, is with regards to the thousands of Palestinian workers, construction workers who work within 48, within the Green Line. Now, in an attempt to prevent mass movement and the spread of the disease, Israel and the Palestinian Authority reached an agreement that as of March 18th, the workers' continued employment was conditioned on them staying within 48, within the Green Line, for several months rather than returning back to the West Bank. Now, the problem with that was that the workers were not only deprived with proper protective equipment, there was also reports of the Israeli authorities just dumping workers who were suspected of having the virus at checkpoints entering into the West Bank without informing anyone, without informing the PA. And there were some horrible videos that were uploaded onto social media of people just sort of lying and suffering in pain at checkpoints. Now, the Palestinian Prime Minister Mohammed Shtayyeh reversed his decision on March 25th, and he ordered the workers to come home. Now, the worry was and remains that the PA doesn't really have the capacity to test all these people that are coming back from 48, from Israel, and Israel itself haven't offered to test them. And even more difficult is that these, many of these construction workers, they are the sole breadwinners in their family units, and they are not being offered compensation or remuneration for the loss in salary, in the salary that they will have to endure. It's been interesting during this period as well that there's been a lot of praise for the Palestinian Authority, and in particular Shtayyeh, from the international community for his handling of the whole situation, because the number of infections is still, official infections is still quite low in Palestine. There are about, I think, like 350 or something, and there's only been 2 officially recorded deaths, which is incredibly low if you look at the sort of worldwide statistics. I suspect, however, that the numbers are not accurate because there hasn't been mass testing, and there aren't the capabilities in the West Bank and Gaza for that kind of testing. But it's important also to critique the PA, I think, during this time. It's been very clear from their economic measures that they have imposed that they are protecting the interests, their interests and the interests of the private sector first and foremost. And we've been seeing this trend worldwide, of course. Capitalism reigns superior during all of this. And I won't dwell too long on this, perhaps we can go more into it in the questions, but a couple of things that they have been doing, they imposed, or they offered recommendations to employers to continue paying their staff. And these were non-legally binding recommendations. So actually there was very little protection for employees. they exempted investors from fees in the stock exchange. Other things that they did was to try and they had various cash assistance and loan programs, but none of these have been particularly successful in mitigating the sort of worst effects on the poor and the working class. So the PA really has been led by protecting itself and protecting the private sector, and it's estimated that about 80,000 additional families have now fallen below the poverty line within the West Bank, and there has been very little support or help from them. But I'll stop here because I think I've taken up a lot of time, and perhaps we can go into some of those points further in the question and answer period.
Thank you so much, Yara, for that very thorough and insightful presentation. And yes, we will have plenty of time to address other things during the question and answer session. As a reminder to those who may have tuned in a little bit late, you can submit your questions through the Zoom Q&A feature or via email to events@arabcenter.org. At this point, I want to turn it over to Deanna to give her perspective on the situation.
Thank you very much, Yousef, and thank you for hosting, and thank you, Yara, for being a co-panelist. It's really a pleasure to be with you today. I want to focus my remarks on what is happening inside 48 and the measures that the Israeli government has taken or has not taken when it comes to dealing with Palestinians who are citizens of Israel. I think it's important to step back for a second and talk about the way that Israel has been viewing COVID-19, the coronavirus. And the approach that they have taken is one that they take in general when it comes to a lot of matters, which is to view this as a, quote, war on the coronavirus. And given that they have taken measures of viewing it as a war, the measures that have since ensued are exactly that, one that you would see that war measures that would be taken with everything from the Minister of Defense involved in decision-making to the army and so on being involved. And what this has meant is that a number of actions that the Israeli government has taken have been designed to, in effect, put into place that war machinery. So one of the first measures that the Israeli government undertook was to try to use the Shin Bet, the Israeli services, to try to track all individuals who have, and track their phones, who've been tested positive with the coronavirus, to then triangulate them with others in order to give a broader picture of what it is that is happening with patients, with contact in different parts of the country. Now, of course, for many individuals who have lived under a system, many Israelis who've lived under a system of a constant, since 1948, declaration of a state of emergency, this didn't exactly ring as something that was fearful for them. In fact, it was quite the opposite. Many individuals were actually applauding these moves. But when you step back and take a look at what it is that Israel is intending to do, it's once again using the measures of the security apparatus, not just to track individuals, but to track where those individuals were, who it is that they were in contact with, and most importantly, to normalize that type of behavior. This is the type of behavior that we have seen throughout 72 years of Palestinian citizens of Israel have been used against Palestinians. Citizens of Israel have been used against Palestinians in the West Bank and in the Gaza Strip. And the attempt is to try to make it a much more normalized practice where individuals don't have any right to privacy, they don't have any rights whatsoever, but they're constantly deemed as being suspicious because they have contracted the coronavirus. And we've seen that that it's only been the litigation that has been on the part of Adalah, the Palestinian human rights organization, that has actually attempted to try to push back on these measures. But it's not just in the question of tracking that we've seen Israeli measures come to fore. We've seen the whole system of apartheid, and I'm delighted that you've called it COVID under apartheid. We've seen the shape of apartheid throughout this period. For example, when the first series of measures were taken, they were taken a little bit over a week after the Palestinian Authority took its measures in the West Bank, and the authorities in the Gaza Strip took their measures in March 5th. Here, the measures began taking shape on March the 12th. And when those measures were initially announced, the measures that were taking place were similar to the ones that Yara has already described. Everything from that we're all living under now, everything from closing down schools to closing down public spaces to closing down courthouses to closing down everything but essential services. At the same time, what the Israeli government did was it started a campaign of doing testing. But yet testing, while tracking individuals or attempting to track individuals using their cell phones, testing was really only done in Jewish Israeli cities and towns. And it was to the point where what we ended up seeing was that grassroots activists, members of Knesset, Palestinian members of Knesset, and so on, had to push the government to actually hold testing for Palestinians who are citizens of Israel. And it's for this reason that we're now seeing that while the numbers have, for the most part, for Jewish Israelis, have started to actually decline, we're now seeing that the opposite is happening, that we're seeing the numbers rise within Palestinian communities. And this is largely because of the fact that there really were no testing facilities until 2 weeks after the testing measures had already taken place in other Israeli cities and in Israeli towns. Now, even to this current date, if you look at the amount of testing that Israel has done, Palestinians, citizens of Israel, comprise about 20% of the population. And yet today, only about 11 to 12% of the testing that has been done on Palestinian citizens of Israel. Now, this trend is very alarming because the only way that they've been doing this testing, as I mentioned, was because of the pressure that had been brought to bear on them. This pressure is not just in the form of requiring testing, but also it highlights the already existing apartheid structure that exists inside Israel against Palestinian citizens of Israel. If you look at the population of Palestinian citizens of Israel, the vast majority of them live in two main areas, in the Galilee in the north, and then in the Naqab in the south, in the Negev. And in both of those areas, since 1948, the Israeli government has not built a single hospital in any Palestinian cities in the north. The only hospitals that exist are hospitals that predate the state of Israel. There are 3 of them in the city of Nazareth, all of them that were established in the late 1800s, early 1900s. And none of these 3 hospitals is really well equipped to deal with any of the coronavirus or any of these emergency situations. And so what we've also seen alongside this, these testing clinics, these mobile testing clinics, is that even in the event that people are testing positive, that there isn't a nearby hospital that is able to treat these individuals. Instead, people have to go to Israeli hospitals to be treated, if there is even an Israeli hospital nearby. The situation is much more acute in places like the Naqab, where we see 80,000 Palestinians without any hospitals, and where we see that the testing that has been done there has been entirely sporadic. What it shows is that it highlights that even though Palestinians form very much a backbone in terms of being on the front lines of the medical system here in the country, that does not transcend into healthcare that is then provided to Palestinian communities. It's quite the opposite. It's the use of Palestinian doctors, but never transcending beyond to actually provide healthcare into Palestinian communities. Now, the issue of Israeli action doesn't just stop at testing. It also extends beyond that. And what we've seen is that throughout this period, there's been a lot of pressure and a lot of measures that have been taken against Palestinians who are citizens of Israel to enforce social distancing, and yet not the same measures taken against Israeli communities, Jewish Israeli communities, to enforce social distancing. In fact, up until just before Passover, there were still measures that were being allowed to have people to convene in synagogues, to have people attend ritual baths, and yet Palestinians were barred from entering into having more than 10 people in mosques to pray together. And so you can even see that the way that they have been doing enforcement has been discriminatory. But beyond just focusing on these measures, there has also been, and I want to highlight some of the things that Yara said and just add a little bit to it. One thing that we've seen that is very alarming is what has been happening with Palestinian political prisoners. As Yara mentioned, there hasn't been testing done. We don't exactly know what is happening in these prisons. And the reason that we don't know exactly what is happening in these prisons is because on March the 15th, Israel passed a set of emergency regulations. Included in those emergency regulations is a regulation that bars Palestinians from having any external contact, Palestinian prisoners from having any external contact. What that means is that there is no family visits and no lawyer visits. And the only contact that individuals are entitled to have is simply with their lawyers, and only if there is a case pending. And as I just mentioned, the courts are actually closed down. This is despite the fact that there have been petition after petition for years to have the basics of just a handheld phone being installed in Palestinian prisons so that they could actually have contact with their family, with their loved ones. And instead, what we're seeing now is yet again another measure that's aimed to lock down the prisons to make sure that that Palestinians are completely kept in the dark. One additional measure that we've seen is that there's been ironically, a jurisdictional fight, which is to say that in parts of Jerusalem that Israel has declared as being part of its municipal boundaries, for example, Kfar Aqqa being one of those areas, the areas that are specifically behind the wall, that even though Israel has failed for years to provide any real services to Palestinians who are living in these areas that are behind the wall, or in Silwan, or in other areas where the Israelis simply refuse to go, that the attempts by others to come in and fill the gap, such as the Palestinian Authority or such as community activists, have been met with repressive measures by the Israelis. So not just coming in and not providing services, but also actively blocking any attempts to have any testing or any mobile clinics being provided in these areas, with just last week, a raid by hundreds of Israeli soldiers, many of them wearing full hazmat suits, going into these areas to shut down these areas. We've also seen that throughout this period in the West Bank, that as the world is telling us that we should be self-isolating and staying at home, that Israel has used the opportunity to demolish Palestinian homes, including homes with children in them. We've also seen that throughout this period that Israel has used the opportunity to go in and conduct raids into the West Bank, arresting Palestinians, including a number of children. And so while the focus has been to try to show just how as Yara mentioned, how cooperative, and how magnanimous Israel has been. The reality has been exactly the opposite. That while the pandemic continues, the occupation is also continuing, and it's continuing under the cover of night, with no real attention being paid to these measures. I want to end by briefly saying that I was in 2002, when I was living in the West Bank. I lived during the system of closures and curfews that came with the Israeli reinvasion of the West Bank. And at the time, the measures that the Israeli government took were measures that people thought were going to somehow disappear. And they fell under the cover of night. And my fear is now that as we're living under this current pandemic, under this current situation, these new Israeli measures that the government is taking are similarly going to become permanent, as they have been permanent for quite some time. But they're going to become, as many people are talking about, the new normal. So everything from continued denial of healthcare, everything from continuing to raid Palestinian families, homes, everything from continuing to demolish Palestinian homes, even at a time when the world is saying we should be emerging from this and emerging better and becoming different. So I'll stop here, and thank you very much.
Thank you so much for all of that, Deanna. I do just want to repeat for those looking to submit questions. Again, you could do so through the Zoom Q&A feature here or via email at events@arabcenterdc.org. Again, that's events@arabcenterdc.org. Before we take some of the questions that are coming in, we'll give people a moment to send them in. I did want to pose one myself to the two of you on an area that neither of you touched on too much, but nonetheless, I think is important fallout to consider here. And that's on the sort of the political fallout in the domestic arenas, both in Israeli politics and among the Palestinians. What implications, if any, does this crisis and the ways in which the governments have went about handling them impact the direction of Israeli and Palestinian politics? And I'll let either of you or both take a stab at that one.
I was actually going to put that in my remarks, but then I saw your message that I should conclude soon. So I'll be very quick, and then Yara, maybe you can jump in. Look, this has also been this has also served as the cover for the Gantz-Netanyahu agreement. So I want to step back. The measures that were taken by the Israeli government were taken after the Israeli election. The Israeli election happened on March the 2nd, and the measures that were taken on March the 12th. Now, in the lead up to those measures being taken, we saw that Netanyahu was really trying to do anything possible to make sure that he is not going to face his trial. And so very quickly we saw that there were measures that were taken to, as I said, shut down the court system. And we have IKEA open, but yet the courts are closed right now. And then that also ended up serving as the impetus for the Gantz-Netanyahu agreement. Now, this Gantz-Netanyahu agreement, when Gantz came forward and announced that he was entering into this agreement with Netanyahu, he specifically said, things have changed since March the 2nd. We have to be mindful of the coronavirus. This is just going to be an emergency government. And because it's an emergency government, we need to come together and come together quickly and soon. Yet, even though it's an emergency government, and this is very important, one of the stipulations that they have in the agreement that they have signed together is that no new legislation can be introduced into the Knesset except legislation that deals with the Knesset with one exception. And that one exception is, of course, annexation. And so we've seen that that even in the cover of the coronavirus, as everybody is focused on the coronavirus, that they still have time to focus on stealing Palestinian land. They still have time to focus on demolishing Palestinian houses. They still have time to focus on raids. And of course, they still have time to push for legislation that is going to lead to annexation.
Yeah, and perhaps I'll just offer a brief comment here. I mean, with regards to the West Bank, as I sort of touched upon very slightly in reference to Shtaya, Palestinian Prime Minister, I think he had a sort of a lot of initial praise, as did May Kaili, the health minister, for shutting things down quickly and for taking, taking the situation very seriously, which I think was right. And they did so because there is an acute fear that the West Bank and Gaza, for that matter, can't deal with an outbreak because the health systems have been completely obliterated by the Israeli regime. But the problem is that there's going to be a serious economic fallout out of all of this. And as I mentioned, the people that will most be affected are the working classes, the poor, and there haven't been appropriate measures to mitigate the worst effects on these vulnerable groups of people, including refugees, of course. And rather, the Palestinian Authority has been focusing on saving the private sector, on focusing on looking after the banks, as any well-behaved capitalist regime does. And so I think that there will be serious after effects of all of this, and I think that will have a huge impact on on domestic politics. I think this COVID-19, I think across the world is an opportunity. It does present an opportunity for us to rethink sort of economic and financial policies, neoliberalism, and I think that's the case in Palestine. We can't forget that the Palestinian economy is bound, is intrinsically linked to the Israeli economy, and it's bound by the Paris Protocol, and it's totally guided by neoliberal policies, which is biased towards supporting the private sector and the banks. So I think all of this does offer an opportunity to think about moving towards supporting workers, the agricultural sector, the produce sector, and thinking about the tax system. But of course, these are all sort of smaller issues in a much sort of wider and larger issue that we have at hand, that the Palestinian economy is an occupied economy. And even though you could do these small policies and small changes here and there, and sort of attempts to reform or revise certain laws here and there, as long as the Palestinian economy remains an occupied one, it will never benefit the Palestinian people, only a small elite, which just so happens to be the political elite. So I think there will be a big fallout in the coming months. Already the Palestinian political scene in the West Bank is very uncertain and very unstable, and I do think that this will have serious repercussions.
Thank you both for that. I want to put a number of questions to you that come into us from the viewing audience. We have a series of questions that come to us via email from Nora Bergen that are all sort of related to food production and availability and movement and access for farmers. Can you speak to what sort of direct impact the crisis has had on farmers in the Palestinian agricultural community, and if there have been restrictions that Israel has placed on the movement of food, feed, and seed during this time, and how Palestinians have responded to these challenges?
Yeah, I can answer that quite briefly. So with the lockdown, there were restrictions initially there have been restrictions of movements in between governorates in the West Bank, so even between very close cities and villages. And of course, this has had a really negative impact on a lot of working people, including farmers, not being able to have access to their land, etc. But the PA did enact a system of permits, of tasrih, which allowed people who had sort of essential business or farms or that kind of thing to still access their land. Now, the problem, of course, lies in the fact that the West Bank is completely fragmented, and many of the roads and in between the Palestinian Bantustans are controlled by the Israeli army. So there has been a complete lockdown there. So it's been very difficult for Palestinians to traverse those areas, and there have been and the checkpoints have been completely, the Israeli checkpoints have been completely closed. So it's been very difficult for Palestinians, particularly Palestinian farmers and workers, to continue with their livelihoods. There have been attempts, of course, by the communities from, just as elsewhere, to sort of try and mitigate the worst of these effects by setting up various funds and volunteer networks to help those who are most deeply affected. But for the most part, there have been individual and private efforts by activists and concerned citizens, and it hasn't been a sort of institutional or sort of authority-wide effort to try and help those in need in terms of food security and having cash to pay for bills and medicine, etc. And so there is a real worry that there are people that are struggling in the West Bank and Gaza and who don't have enough food, especially because those are the ones who rely on daily wages. So that worry continues, and unfortunately there hasn't been enough done to sort of protect and help these people. And all of this is exacerbated by the Israeli occupation and the fact that the West Bank is totally fragmented anyway.
Thank you for that, Yara. Deanna, I think this one is directed more to you. Can you talk about the treatment by the Israeli authorities of Palestinian healthcare workers in 1948 area, even though they make up a significant proportion of the Israeli healthcare system?
Yes, thank you, Yousef. So the Palestinian citizens of Israel and Palestinians who are from the West Bank are also both essential components of the healthcare system. And so I first want to talk about workers, what they classify as workers, Palestinians who are coming from the West Bank. These are individuals who for years people have been requesting permits, been saying that there shouldn't be permits, they should have the ability to actually live in the places that they work and so on. And for decades, these individuals have been classified as being a blanket security risk. They suddenly overnight became part of the essential services. And in turning from security risk to essential services, Yara mentioned exactly some of the treatment that we've seen in terms of the failure to provide testing, but we've also seen that there's been complete lack of housing and a failure to really take care of these individuals who are very much providing the essential services for the healthcare system. At the same time, there are also a large number of, or let's say, I don't want to say a large number, but a disproportionate number of Palestinians as compared to the population are in the medical system. And we still see the same level of discrimination. In fact, on the very day that the Prime Minister Netanyahu was applauding these doctors, he brought them in to have a congratulatory thank you so much for all of the things that you've been doing on the front lines, and then in the same breath turned to them and said, but you are not doing enough in your community to make sure that social distancing is happening. So it's, they have been very much serving as the backbone of the system, but yet on the front lines of discrimination, whether that's discrimination because of the classification as security threat, or discrimination because the daily discrimination that they face. But they've also been used by the Israeli authorities to somehow show that there's this wonderful model of coexistence, that, that look, we're such a great society because we actually have Palestinian doctors on the front lines. It's only like a society that views things in this way. Like, can you imagine in the United States saying, oh, look, we also have Black doctors as well. That you can see just the racism that is pervading them, that they have to highlight that there are actually Palestinian doctors that are on the front lines of dealing with the coronavirus. And so they've been both on the front lines of dealing with it, and of course on the front lines of the Israeli racism and discrimination.
Thank you, Deanna. This question is for either or both of you. Can you talk a little bit more about how the siege on Gaza has affected the healthcare system there?
Yeah, I mentioned a little bit during my presentation about Gaza. The siege, the blockade of Gaza has had an incredibly devastating effect on all aspects of Gazan infrastructure and society, and the healthcare sector is one of those areas that have been really badly affected and devastated. Not only is there a complete shortage in medicines and staff, for that matter. Specifically with regards to confronting COVID, it's important to note that there are only 78 ICU beds and 63 ventilators for a population of 2 million, and that's shockingly low. And you know, it's been luck so far, I think, and also because of the sort of quick efforts to lock things down, that there hasn't been a more serious outbreak. But we also don't know the true number of people infected in Gaza, because there are not enough testing kits. Now, before the outbreak, before the pandemic, Gaza was already struggling to deal with the health cases that they already had on hand. People were dying because they do not have access to the most basic health needs and the most basic of health procedures. They rely on the supposed goodwill of the Israeli regime to give them permits so that they can get treated elsewhere. And let's not forget, during the many military bombardments of Gaza, the Israeli army has frequently targeted Gazan hospitals. So many of these hospitals still have not recovered from being totally obliterated and bombed, and many of them are still have, you know, holes in their walls and no roofs. So you really have a very, very dire situation when it comes to the health sector in Gaza. It's very worrying. And there are efforts to try and to prop it up, such as by Medical Aid for Palestinians, an organization that has launched an appeal for donations, and also UNRWA, which is struggling in terms of funding as it is, but they also launched an emergency appeal to try and mitigate the worst circumstances. Just an anecdote that really highlights the situation in Gaza. So many people are living under the poverty line in Gaza that people are going into pharmacies to buy not packets of painkillers, but a single pill, a single painkiller. This is the situation that so many Gazans are in. So they go to the pharmacy, as you and I usually we'd buy a packet which might have 16 pills. There are people in Gaza that are only buying one pill at a time because that is what they can afford.
Thank you, Yara. our final question before we wrap, this one's directed to Diana. And the question asks, have home demolitions increased during this period, during the crisis period, or are they just continuing as they previously were?
They're on the same pace. So they're continuing at the same pace as they were before. One thing that we've seen that has increased is that there's been much more of an attack on, much more demolitions of Palestinian, like if they're not homes, but for example, establishments, like if they have a work establishment, that we've seen with much more frequency than in the past. But in terms of home demolitions, the homes have continued at the same pace. The alarming part, of course, is that when you're demolishing a home at the time when people are supposed to be staying at home, the question becomes, where do these people go? Where do the homeless individuals go? And because of the fact that almost everything has been shut down, that the basic systems that were in place to be able to absorb individuals, to give them alternative shelter, are also not really in place at this point in time. And this is where we've seen that much more grassroots initiatives to try to come and make sure that everybody is being protected in this time. So normally there would have been alternative shelters, but that is something that we aren't seeing at this point in time.
Thank you for that, Diana. Well, with that final question, that will conclude our conversation for today. But I know that this is something that we will all be continuing to monitor very closely in Palestine and elsewhere. On behalf of the Arab Center, Washington, D.C., I want to thank you both very much for your participation today, and for all of those who joined in viewing this webinar virtually. And hopefully we can do this in person next time, some point in the near future.
I hope so.
Inshallah.
Thank you all very much.
Thank you for having us.